I began to realize that competing in a healthy way with restorative dentists and periodontists would require oral and maxillofacial surgeons to learn more about dental hygiene, more about dental maintenance, more about implant maintenance than just simply taking the tooth out as a resolution to it. And so then we create more of a unique environment for the oral and maxillofacial surgeon. I also see that 10% of implants develop peri-implantitis. So being honest with ourselves as to why that happens, which the course has taught me a huge amount in, and that even in the 4 months now I've had the laser, I've learned even other reasons more than just occlusion. Occlusion's huge, but there are other marked reasons why. And so LANAP allows us to treat the implant plus all the diseased teeth around it. And that provides a more comprehensive care to our patients. My very first case that I did was an implant case where a particular implant was used that I'm really not familiar with at all, so I couldn't really figure out parts and pieces to it, and the patient didn't know what it was, and it was a cemented prosthesis, so I couldn't take it off. The patient had lost attached gingiva on about 5 or 6 threads, and it was starting to develop peri-implantitis, inflammation, pain and bleeding when she was brushing her teeth and brushing her implants. What I did was develop an idea of how to apply it to that. And so I used a very, very strict lip-pip technique. First we did lip-pip all over the mouth, kind of cleaning up the mouth, making sure the bacteria title was low. And then what surprised me was just how quickly the soft tissue responded. And then when I saw her 3 months later, all the threads were closed, were covered up. And I combined that with a horizontal mattress suturing technique with some permanent suture that worked extremely well. What surprises me the most is the versatility of the machine. One might say, well, it's how it resolves, implant issues, peri-implantitis or periodontal issues. Well, that didn't surprise me because we're inundated with the data that exists and the history of the machine and what it does. So I'm not surprised about that. What I am surprised about is the incredible versatility. That's what I'm really surprised and intrigued by, because I think there's more going on than what we even know, which is always exciting for me to find out. I believe we're only touching the tip of the proverbial iceberg when it comes to the application of this technology.